So after we've indicated the patient for surgery, there are multiple things that they need to do in order to be fully prepared. One of the most important things is to do a preoperative visit with their primary medical doctor. This confirms that they're a good patient for outpatient joint replacement. They have blood tests, a chest x-ray, an EKG, and basic medical tests. And their medical doctor essentially ensures that they are optimized and ready for surgery. The other important thing is for them to select a coach, which is a person who is going to be at home with them after surgery to ensure that they're going to have a good outcome. This is someone who can help them get in and out of a vehicle, get around their home, make sure they're safe, help them with distribution of medicine, help them coordinate nursing and physical therapy, that type of thing. We have an entire pamphlet that we've authored with respect to outpatient joint replacement, so the patient has an actual hard copy booklet describing essentially what they need to do to prepare their home and get ready for their outpatient surgery. And this is oftentimes very much common sense things, such as making sure there are no loose carpets or wires such that they would avoid falls, ensuring that they have a safe way to bathe or shower after surgery. Typically our staff, our surgical coordinator, will provide that pamphlet to them, which walks the patient through the entire process of having a partial or total knee replacement in an outpatient setting. And we will review that packet with them, go over any possible questions they have, just to make sure that all of their questions have been answered and they're fully comfortable with respect to the entire process. I think the coach needs to be committed to being with their patient, especially for the first several days. That's the most critical time period. They want to be available to the patient such that they can make sure that they're having a good and safe and healthy recovery.